everyone, my name is Melissa Alvarez and today I'm going to be talking about preventable harm in the healthcare industry. So to begin, whenever someone experiences pain or symptoms of an illness, the first place one seeks help is the hospital. One would think that that is where they will get better or cured of whatever health issue they're experiencing. After all, doctors, nurses, and medical staff have dedicated their whole lives to ensure the betterment of a patient and have vowed to do absolutely no harm. Therefore, why is it that thousands of individuals in the United States have been victims of preventable harm while receiving care in hospitals? Preventable harm is one of the biggest issues that the healthcare industry has faced for many years. The Institute of Healthcare Improvement defines it as unintended physical injury resulting from medical care, including the absence of care, that requires additional monitoring, treatment, hospitalization, or that results in death. Preventable harm can be experienced by a patient in many forms, for example, such as in-hospital injuries, such as falls or bed sores, the development of hospital-acquired infections, allergic reactions due to medical error or medication errors, surgical errors, misdiagnosis, and in the most extreme cases, even death. A study conducted by the Johns Hopkins Medicine claims more than 250,000 people die each year from preventable harm, and other reports claim the numbers to be as high as 400,000 individuals each year. Additionally, preventable harm has a financial and emotional toll for everyone involved. According to a study, if we were to include the indirect costs of preventable harm, the economic impact can easily reach $1 trillion annually. Preventable harm also causes tension among healthcare providers because doctors have to spend more time with certain patients over others. These setbacks cause resources to get stretched, creating an environment that could produce more instances of harm and a loss of morale. The healthcare industry has given a lot of effort to reduce these alarming statistics and improve the quality of patient care. One of the proposed solutions has been to incorporate systematic safeguards to reduce human error when treating patients. These safeguards serve as a checklist to avoid systematic failures, such as dysfunctional teams, lack of resources, bad communication, or poor health administration staff, and all this can lead to patient harm. It is important to emphasize that continuous monitoring of adverse events along with working to update policies and safeguards is the best defense against repeated adverse medical events. In theory, the solution should reduce the rates of preventable harm in the United States. The incorporation of safeguards has been used by many hospitals all across the nation. Therefore, why is this still a massive issue? Well, one of the biggest obstacles that has been seen and encountered is the acceptance of safeguards on behalf of the medical staff. If a practitioner rejects or half-heartedly accepts systematic safeguards, it does not work. The only way it will fully work is if it's fully accepted by everyone on the medical staff. For example, a study titled the Michigan Keystone Project implemented a 5-step checklist, which led to a 66% drop in central line infections. Preventable harm reduced by a great percentage, therefore the issue of acceptance is something that needs to be greatly addressed. Therefore, in order to improve acceptance on behalf of the medical staff, I propose that an informational workshop be provided to the healthcare staff about the benefits of incorporating safeguards into their practice. In these sessions, healthcare staff can ask questions and voice their doubts or opinions on the matter, and an expert can help clear any doubts or any misconceptions about the use of safeguards and can back it up with factual evidence on why it works. This workshop would also be beneficial in allowing the healthcare provider to reflect on their individual private practice, because most of the reasons that practitioners do not incorporate safeguards is because they feel that preventable harm and human error is something that doesn't apply to them. Therefore, going to these workshops will allow them to reflect and maybe realize things that they didn't realize were there before. There has also been instances where practitioners do want to accept safeguards wholeheartedly, but they simply do not know how to incorporate them effectively. Healthcare providers are already met with the high demands of working in a fast-paced environment. Therefore, adding safeguards is difficult for them to add on top of all the other responsibilities that they already have to deal with. Therefore, this workshop can provide successful tips and little tricks on how to build up into successfully incorporating these safeguards into their care. Therefore, preventable care is a big issue in the United States healthcare system. It is something that affects thousands of people each year and in the most unfortunate cases results in the loss of someone's life. This problem can be fixed with the incorporation of an infrastructure in the form of safeguards. It is a solution that has proven to work when everyone is on board and everyone in the healthcare system fully embraces and incorporates it when providing care. Therefore, it is crucial that safeguards are incorporated and implemented in the healthcare system. Well, thank you everybody for watching.